welcome to every one of you to this important and timely CME on achieving Sustainable Development Goals 3, de-addiction of drugs, alcohol, tobacco and smartphone. I invite Dr. Mohsin Wali to share his views and throw light on this topic. Sir.
Now we are losing 12 to 15 years of our precious life due to these addictions, and which is defined as an inability to stop using a substance or engaging in a behavior even though it may cause psychological or physical harm. Now there is something called huffing, you may be aware. Huffing is what you sort of inhale, and this is what is common in hospitals, and these are products like thinners we inhale and get used to it. And this is the most important slide of the presentation today. If you see, people are falling as the cigarette is burning, people are falling in a trap of death. So this is what smoking does with about 4,000, more than 4,000 toxicants. It is not only nicotine, but it is something else which irritates the lungs, which irritates the mucous membrane and causes cancer. So nicotine alone is not a disaster. In tobacco addiction, we lose a lot of lives, either due to lung cancer, stroke, or lung disease, heart attacks. In India, great number of people are victims of alcohol addiction, and the only basis of treatment is detox, cognitive and behavioral therapies, and medication-assisted therapies. This is a long video I don't want to show, but the message is in New Zealand, they tried to strictly stop smoking and they could not do it. So we have to watch the person who is in a habit of nicotine addiction and find out the ways. That is what we call as nicotine replacement therapy, and now it is available. Luckily, we can crush this packet of cigarette and take the help of these approved forms of therapy: sustained release bupropion, nicotine gum, nicotine inhaler, nicotine skin patch, and nasal spray with counseling. We also have vapes or vaping, which has reduced smoking incidence in Europe and other countries, but in India it is not allowed. So nicotine gum, nicotine patches, micro tablet, lozenges, inhalers and sprays are available. And then we have cigarettes also, with a very limited quantity of tars and less of adulterated ingredients, and low tar cigarettes are there, which are available a little costlier, so people will smoke less. There is another technique which is very popular in some of the European countries, and this is you don't burn the tobacco, you heat the tobacco. So this is called nicotine vapor. It is inhaled either directly or in disposable cartridges, and this is less toxic. Because nicotine is not the culprit. The culprit is the add-ons, 4,000 plus add-ons in the cigarette. But vaping in India, we have to wait, trying to find out these cessation approaches. It is all for improving health, achieving and maintaining abstinence, results in significant improvements to physical and mental health. So there are long-term risks and considerations. There are withdrawal symptoms, there are co-occurring mental health disorders. As I said, social and environmental factors are very important. There are alternative treatments for substance cessation. We have to go a long way to find out and learn them. And without peer support and community engagement, it is not possible. The common theme is integrated approaches for co-occurring disorders and actually adaptive interventions. And the takeaways are tailored treatment plans which lead to significant improvements in the patient outcomes and emphasize the importance of considering individual characteristics and environmental influences in addiction treatment. Addiction complications you will have to deal in your day-to-day life, so you have to be prepared on that. and there is a thorough relevance of the SDG 3 goals, and with our Nasha Mukti Indradhanush Abhiyan, which is on the same lines, which is our Prime Minister's dream. You all have to take part, sign here, and go back from here, that whatever you will do as a practicing doctor, you will integrate this into your medical practice, leave the well alone, promote yoga and health, and try to tell the power of the prayer to your patients.
I will now invite Ms. Kavita Malhotra to share the presentation and share her thoughts on today's topic.
So ACHA is a non-governmental organization basically that because we aim to promote health, empowerment and well-being for all, which directly coincides with the Sustainable Development Goals, and we keep organizing such kind of CMEs and events to address the global issue of addiction and its consequences. And I'm glad, and a big thank you to HEAL Foundation for introducing the campaign Doctors Against Addiction. Honored to be a part of this campaign. So addiction has a very complex nature, and it starts in the brain. Food is a very important part of our culture, of our background diversity, and hence, food, nutrition, and addiction are deeply correlated to each other. Chronic substances or the use of these substances directly affects your memory, your decision making, your judgment skills. Forget physical, mental, and everything. It directly impacts your cognitive ability and behavior, and hence we need these kind of integrated approaches. This is an interesting KPMG study that I came across, and the crux of this study is that approximately 40% of the adolescents or people who are in the early years of their college fall prey to this global health issue called tobacco consumption. That's the bottom line of this KPMG study. Integrated approaches means we need to understand the risk factors, we need to understand what is going wrong, and understanding the vulnerability side of it, and create customized, curate, tailored treatment approaches. If you see this triad, and on the top is your alcohol intake, then is your individual vulnerability. It can be your macro environment, it can be your micro environment, and the society environment. This is another study that I wanted to share. Carbs, proteins, fats की सब बात कर लेते हैं, लेकिन micronutrients की बात कोई नहीं करता है. What addiction leads to? Studies have shown that it leads to numerous micronutrient deficiencies, and especially the omega-3 fatty acid deficiencies. If we are addressing addiction, we need to address the root cause, that is nutrition, at all given points, because nutrients such as B vitamins and your beta-carotene, they are very essential for the neurotransmitter production, regulation, antioxidants and oxidative stress. We always need to be a bit more preventive when we are talking about antioxidants, and it plays a huge role in reducing the oxidative stress in people who are juggling with addiction of any sort of substance. So in summary, eating sensibly and mindfully, choosing the right range of foods, moving every 1 hour, drinking moderately, very moderately, only if required, stop smoking and have preventive checkups, know your numbers, and if you know your numbers, you will catch hold of the problems faster. Of course, in your patients also, when you start practicing, or if you see somebody with these kind of symptoms, and the sooner the preventive action is, the better it is. Thank you.